Hello, my name is Alicia Cristalis, and I'll be presenting today on mindfulness meditation as a school-based intervention in response to self-regulation and risky behaviors in children and adolescents. So, mindfulness meditation. Children often present risky decision-making. Cognitive abilities are not fully developed until late adolescence or early adulthood. Increases in risk-taking and thrill-seeking behaviors, decreased ability to exercise self-control, rise in drug use, initiation, maintenance, and dependence. All these are risky decisions that adolescents tend to partake in because they are not fully developed yet. Mindfulness meditation may improve adolescents' executive functions to help prevent drug use and abuse. Decision-making. As adolescent brain development impacts teen decision-making. Childhood ADHD resulted in greater risky behavior and earlier initiation of sexual activity. Teens who showed poor executive function skills at 10 to 12 were more likely to associate with deviant peers at 16 and development of drug abuse by age 22. Teens engaged in risky behavior to experience novelty and sensation-seeking behaviors due to increased sensitivity to dopamine and hedonic effects of drugs and reward agents. School-based interventions are being researched to target children at younger ages to improve executive functioning during adolescence. As you can see, in the prefrontal cortex region, we have our emotional responses, attention, and behavior and judgment. Because the PFC is not fully developed in adolescence, and full maturation of the PFC and executive functions will not appear until young adulthood. This immaturity often leads to poor inhibitory control, higher impulsivity, risky decision-making, poor self-regulation, which also leads to risky behaviors, including drug use. Longitudinal samples have shown that early adolescent deficiencies in executive function predict later drug use disorders. So it's very important to have interventions that will target these areas. Some of these interventions have been found to be mindfulness meditation. And these have been used to decrease risk-taking and thrill-seeking behaviors, able to increase the ability to exercise self-control, increase executive functions to help prevent drug use and abuse. These interventions often target executive function development and self-regulation, which assist in reducing risky behaviors and poor decision-making. This is important because children's cognitive abilities are not fully developed until early adulthood, which causes poor decision-making throughout their lifetime. So as it increases attention and control, working memory and inhibitory control will successfully execute short-term goals. And so as children are able to become more competent with mindfulness, they're able to really have the ability to follow their short-term goals and achieve greater results. This helps them to manage goal and future-oriented behaviors, be able to process their sensory perceptions, which can help with children who have sensory disorders. It helps them have more focus on their body, more ability to understand what their body is doing, how their body is responding. And they'll be able to discriminate what's going on with their body. It's not necessarily how they feel. And this is very important if they have high anxiety or they have stress-related disorders. We don't know that what's functioning in their body is normal and how to separate that from what's actually going on in the outside world. This helps impact their short-term memory. It also has positive impacts on behavior, social and emotional development, improved decision-making, and reduces vulnerability to stressors that cause behavioral issues in schools. So what is mindfulness? Mindfulness helps us to focus on the here and now. It decreases rumination or thinking about something over and over again. It increases decentering. It helps enhance self-compassion and also increases greater empathy for others. It decreases emotional reactivity to the world around us and helps foster positive affect and decreases stress. As you can see with this brain scan, it shows that mindfulness meditation leads to structural changes in neuroregenesis. From the baseline picture to the meditating picture, you can see how areas that had places that weren't filled in are now filled in with activity. Increases in the left prefrontal cortex region activation also reduces vulnerability to stressors that cause behavioral issues. So that's why this is so important for use in schools where there's behavior problems due to different issues that children might be having, because having that skill will help them with any stress that they're having in school or at home to help them combat those behavioral problems. Research on mindfulness meditation was often limited due to lack of controlled trials, non-randomized designs, and lack of sample diversity to include urban and diverse youth. Current research is growing to include more controlled experiments, randomization, and increased sample diversity on interventions with children and teens. Recent fMRI findings have shown increases in the executive functioning of the PFC, particularly in the area of attention control, self-regulation, sensory processing, memory, and regulation of stress response, as I've mentioned earlier. So mindful meditation can go across the entire lifespan. And so as research has been finding, the earlier that students start in receiving mindfulness training, the better their outcomes will be. And so one intervention was conducted in a preschool setting. This is called the Kindness Curriculum. And it was an intervention group of 30 students in 3 classrooms at 6 different schools, and a control group of 38 students in 4 classrooms. This was a mindfulness-based intervention with trained instructors who visited the participating classrooms twice weekly for 12 weeks, giving a 20 to 30-minute lesson during each visit. The results found that intervention group was better at sharing and scored higher on their year-end assessments than the control group. This has found that even children as young as 5-year-olds can be taught mindful breathing and attention to their thoughts and emotions to foster more focused. An elementary school intervention is one that I found was called I Can Problem Solve. This was designed for 4 to 12-year-olds. It was conducted in classrooms from 10 to 20-minute sessions 3 to 5 times per week throughout the entire academic year. This intervention has been studied for over 30 years. And so it would be a good one to bring into a school system where you might not see any type of intervention already that is not being done. The skills have been linked to actions with consequences and provided alternative solutions. They use games, group discussions, puppets, and role-playing. It was successful at improving impulse control, indirectly promotes executive function, and increased concern and awareness for others in distress. It also increased children's ability to make friends and get along with others. This intervention helped to decrease physical, verbal, and relational aggression because it helped increase the student's empathy. It also decreased over-emotionality and inability to wait and cope with frustration. Another decrease was in social withdrawal of students from others. It had marked increased gains in academic achievement scores for that school district. Another investigation is a mindful minute. This is called the RAIN technique. I'm going to play it for you now. And so as you can see from that video, they presented the RAIN technique. It's recognize what's going on, allow the experience to be there just as it is, investigate with kindness, and bring your natural awareness, which comes from not identifying with the experience. And so that's a very short 1-minute technique that any teacher could possibly provide to their student. These mindfulness interventions are really easy to slip into your everyday classroom, into your everyday life. And so they don't usually require a lot, and they're very inexpensive. It just takes some time to build it into your daily routine. Another elementary school intervention was promoting alternative thinking strategies or paths. This was designed for ages 3 to 12. It's an effective behavioral cognitive dynamic model. It focuses on neurocognitive model that emphasizes higher order cognitive processes over risk-taking tendencies. Training focuses on strategies for self-control that facilitates inhibitory control and planning with visual posters to be used as cues for the thought process. So a poster like the one on the left would be presented throughout the classroom or throughout the school to help students remember what they're supposed to do when they're having to control their behavior. This has been shown to be effective in reducing externalizing and internalizing behaviors, improved inhibitory control, and increased executive function development and emotional behavior recognition. So the control signals go from the top to the bottom. So stop. Take one long deep breath. Say the problem and how you feel. It's best when they speak the problem out loud. And then the students are asked to make a plan. Think, what could I do? Would it work? Then they're supposed to go ahead and try their best idea. Then see how did it work. This thinking helps them try to discover a process for how to solve problems. So it's not necessarily did they achieve their goal or not, it's stopping, thinking about it, and then putting the plan into action. The next study that I found was based in Baltimore City, and they're trying to work with urban youth who were at a disadvantage. They're often acting out and had lots of emotional and behavioral issues. And so they brought in mindfulness, meditation, and yoga with the Holistic Life Foundation. Their goal was to counter psychological and neurocognitive effects of chronic stress exposure by cultivating a state of calm attention and awareness to produce improvements in involuntary stress responses, mood and relationships with peers and teachers, evaluate intervention feasibility and acceptability in the community. So two schools were randomized to receive 12-week intervention with social, emotional, and behavioral outcomes assessed as a baseline and immediately following the intervention. Each session lasted 45 minutes and scheduled during resource time similar to art, music, or gym. And this was a really important part of the intervention because it allowed the students who were selected for the study not to be singled out. So if they went during resource time, they weren't missing out on regular class time, they weren't missing out on regular course instruction. And so it's just like they're going to the gym for a regular activity and not necessarily for like therapy or for any other type of intervention. And so it helped more normalize this intervention than would have been expected. And so the students reported enthusiasm about the plan, and they didn't have any difficulty recruiting participants for the program. Students responded that they now have skills to deal with stress at home and school, that they don't have to respond to stress by fighting, and helps them to remain calm. Over 73.5% of students at one school completed at least 75% of the program, which is really amazing because many of these students in these schools may have dropped out. The thought of actually having 73.5% at the end of 12 weeks in any school where you have disadvantaged youth who are always moving around due to losing housing or other issues with the family, for them to have completed was really impressive. But unfortunately, teachers at the second intervention site punished children for their poor behavior by restricting their access to the program. These teachers didn't understand the value of the program, so that resulted in only 40% attendance in the program at that site. This is really unfortunate because the students who would have participated in the program would have actually had more help with their behaviors. And so there was a lack of training and understanding on the teacher's behalf for what the program was useful for. After the intervention, they had a teacher-focused group, which resulted in positive feedback that training in awareness and attention would have offered significant advantages for students who struggled with behavioral problems, high activity level, and poor attention and focus. The teachers wanted more training so they could reinforce the skills presented by the intervention. And so that was a good outcome from this study. Now we're moving into middle school, and so seeing throughout the whole lifespan of the child as the child develops, these skills can be built upon each other from preschool to elementary to middle school. And so Visitation Valley Middle School in San Francisco was one of the first schools in the nation to introduce the mindfulness meditation intervention with positive results. And so the population was at-risk students in the middle school who were primarily of Latino descent and non-English speaking as their primary language. The results of this intervention showed that 45% reduction in suspensions for the school, 98% attendance rates, and improved grade point averages. There is twice as many students who scored proficient in English on the California Achievement Test in similar schools in the district, which is impressive, as well as they had the highest happiness levels for a school in San Francisco. So it's mindfulness meditation interventions affect the whole child. It's not just treating a behavior, it's not just treating a problem, it's actually treating the whole child holistically more than just on one issue. So these are other posters that can be put up in classrooms or used to help model the behavior of mindfulness with students. And so on the left-hand side, there's a team poster that says, "Stop. Stop what you are doing. Check in with what you're thinking and how you're feeling. Take a moment to breathe. Practice mindful breathing to create space between your thoughts, emotions, and actions. Think. Learn to broaden your perspective and strengthen your force field of peace and calm by practicing one of the meditations that you learned." So this could be a poster that is set up in the hallway in a high school so that students are reminded to stop and take inventory of their own actions. On the right side is a brochure about how to conduct mindfulness with elementary students and how they could respond to situations with mindfulness and without. So in the upper strip, it shows without mindfulness. Student receives a stimulus where the girl steps on his foot. The boy's like, "Ouch." And he reacts with a negative reaction of stepping on her foot, which then escalates to more physical behavior of stepping on each other's feet, which would result in more fighting. With mindfulness, the student has his foot stepped on by the little girl. He says, "Ouch." Then he stops for a mindful minute and says, "Did you really try to hurt me by stepping on my foot? Do I need to retaliate against her?" Thinks, nope, his response could be, instead, rather than a reaction, says, "Please be careful." And the little girl says, "Oh, I'm so sorry." And he says, "It's okay." Additional mindful moments are another event reaction sequence. So let's say, for example, a teenager steps on gum in the hallway. And so an event, a problem, or a challenge is given. So she could storm off and say, "I'm so mad," and not even go to class that day, running off of her feelings and behaviors. Instead, she could say, and taking a mindful minute after stepping in the gum and say, "You know what, that's okay, that happens. I can still go on to class and I'm not experiencing anything that's a big deal." So the benefits of school-based mindfulness interventions for home and school have been found to be easy to work into classroom routines, quick positive results, strategies to control behavior and manage anger to increase feelings of calm, strength, and focus at school. This curbs negative behaviors, prevents drug abuse, decreases negative classroom behaviors, decrease in school suspensions and criminal charges, improve concentration, focus, and attention to listen in class, focus on exams, and playing sports. Decreases negative behaviors that lead to fighting, property destruction, drug abuse, emotional deregulation, and school expulsions. The benefits for the child are works well with children as young as 3 throughout their entire lifespan, greater sense of well-being, happiness, calm, and feeling more fulfilled. They have increased confidence to fulfill their potential and pursue their own goals, increased ability to regulate their emotions and behaviors so they feel more in control, improves their executive functioning as their prefrontal cortex matures, so they'll have more ability to work with that aspect as they mature. As they're provided skills to cope with everyday stressors like family, friends, relationships in the future. They'll know that they can trust and listen to their own voice and how to turn their intelligence inside themselves. Ability to manage difficult mental states such as depressive, ruminative, and anxious thoughts and low moods. Ability to handle emotions, depression, anxiety, and fear. And overall improvements in behavioral regulation, metacognition, and global executive control in children with lower executive functioning scores. Overall, every child who has participated in these interventions seems to come away with a positive feeling of having skills that really help assist them in making better choices and learning how to react to the world around them. The benefits of mindfulness meditation for adolescents. Teens have been found to reduce distress, anxiety, and emotional and behavior reactivity, and improve self-awareness in teens. The research has found that it is well suited for chronically stressed children and improves aspects of executive function, including self-regulation, responses to stress, mood and social emotional environment, and their development, and creating a positive impact on the future of at-risk youth. And so children who are at risk for suicide or running away, having this ability to emotionally regulate themselves and having the ability to calm themselves down and self-soothe with something that's not harmful, because typically instead of having alcohol or drugs or self-harm, they could then take a moment to relax and take some self-care. And so mindfulness is really about teaching children and adolescents about self-care for themselves and how to make sure that they're feeling well. The future of mindfulness meditation interventions, they're moving away from focusing on specific symptoms and disorders to enhancing youth capacities for cognitive and emotional regulations. So it's not so much focusing on do they have depression or anxiety or do they have ADHD. It's as a child, as a whole child, how can we help their cognitive and emotional abilities? Mindfulness meditation interventions enhance regulatory capacities, executive function development, and resilience to stress that results in behavioral issues and risky decision making. So overall, we see a great decrease in these risky decision making because they're provided with tools for students to create better decisions. In conclusion, a positive increase for these interventions are they're easy to implement and very low cost, help a wide range of children from 3 to 18, learn skills can be used for a lifetime, greater sense of well-being, increase confidence to fulfill potential, improve concentration, cope with everyday stressors, handle emotions, depression, anxiety, and fear. The negatives are decrease in negative behaviors, decrease in school expulsions, decrease in property damage, decrease in drug abuse, and decrease in emotional deregulation. And so overall, these negative behaviors really have a great decrease in them. And then here are the references in case you'd like to look them up. Thank you.
Good job.